Hello guys, this is Erika Buenrostro, your Spanish instructor for Spanish 1014 at UA Casa Tot. Welcoming you again to this week's lesson. We are going to focus on and dive into medical terminology, prefixes, and suffixes. One of the reasons why I felt it was super important that we actually add this to this class this semester is because during your lifetime, whether it be now or in the future, you're going to run into medical terms in Spanish. You could be sitting in the waiting area, you could be looking at a TV commercial, you could be looking at a soap opera maybe in Spanish, or you may be working in the medical profession. And so that's why I felt it was super important to actually make this part of this week's lesson. So why is it important? Medical terminology is a specialized language. If you have ever heard medical terminology, it is its own language, right? In the ways of stringing words together in a format that is acceptable, that is understandable to everyone. But unlike a foreign language, you come across medical terminology every day in magazines, newspapers, with articles, when you're reading about new drugs, diets, new medical treatments, and in medical dramas that appear on television. And so let's talk about some of the most common words in Spanish that you may run into, or that I want you to actually focus on for this a specific lesson. We're going to talk about body parts and health conditions that will help you get the medical assistance when you need it, or to help others when they need it. These basics, the basic vocabulary can help you find a doctor, describe your alignments, and get and get treatment. So we're going to look at the eyes. As we can see, the eyes is el ojo, okay, and nariz is nose, boca is mouth, oreja is ear, diente, tooth, lengua is tongue. I'm going to pronounce these once again for you. Ojo, eye, nariz, nose, boca, mouth, oreja, ear, diente, tooth, lengua, which is tongue. You have to make sure and actually add this to your own personal dictionary. Okay, so let's talk about vocabulary for health conditions. So if you have somebody that is having pain, they're going to call it dolor. Okay, they're going to say in full sentence, you would say el dolor. Burn is quemadura. Okay, as you see it right here, quemadura. If in full sentence, it's going to be la quemadura. Dizziness, okay, is el mareo, and I have learned that a lot of people in this area actually call it they'll say borrachera, which is another medical, it's another way for Latinx people in this area to actually say that they're dizzy. So dizzy is el mareo. Allergy is alergia. Flu, la gripe. Fractura is fracture. Okay. So phrases for illnesses. So for example, if somebody's having shortness of breath, you're probably going to hear them say dificultad para respirar. When they say my head hurts, they're more than likely going to say me duele la cabeza, or sometimes they'll say dolor cabeza, and I need help. Necesito ayuda. And this is not necessarily just in the medical profession. You could be out and there could be an accident and somebody could be saying necesito ayuda. And so there's that way to also, or another good reason why to learn medical terminology. So if somebody comes in and they say, I have fever, fever is fiebre. I have is tengo. So tengo fiebre is I have fever. No me siento bien means I don't feel well. Okay. So now then let's move on to, this is actually a practice exercise that I want you to do. You will post your answers to this particular practice exercise into this week's discussion board. Try not to look at anyone's answers. Okay, so make sure that when you're doing this, try your best to translate. Some of these we've not gone over. So I'm fixing to help you with that as well. So make sure that when you actually start looking at your discussion board, you have a dictionary beside you. That will make it easier. And then, of course, make your own personal dictionary. We said eyes was ojos, nose is nariz, mouth is boca, ears is ears is I'm so sorry. This is all coming together for me. Orejas, tooth is dientes, tongue is actually lengua. So ojos, nariz, boca, oreja, dientes, lengua. Okay, and you've got several down here that we've not gone over. I want to see how much of these down here you can actually find yourself and share with us in the Blackboard discussion. Okay, so I look forward to everyone's answers. All right, so let's talk about what's inside. So the bone is hueso, muscle, músculo, blood, sangre, lung, pulmón, heart, corazón, stomach, estómago, liver, hígado, appendix, apéndice, intestine, intestino, bladder, vejiga, gallbladder, vesícula, kidney, riñón. Okay. Common symptoms and illnesses that you'll probably hear if you work especially in the medical field. Here are some other common symptoms you may run into or have to explain. So for example, swollen is inflamado, sensitive is sensible, in pain or sore, dolorido, dolorida if it's feminine, irritated, irritado, urgent, urgente, burn is quemadura, fever, fiebre, stuffy nose, nariz tapada, shortness of breath is dificultad para respirar, or in this area you may also hear no puedo respirar. I'm actually going to write it in for you, that way you can also have seen it in writing. Okay, tos is cough, high blood pressure, la presión alta, low blood pressure, la presión baja, mareo, dizziness, vómito is vomit, pain is dolor, heartburn is acidez, migraine, migraña, cramp, calambre, seizure, convulsiones. And finally, here's some of the common illnesses and conditions in Spanish and their English equivalent. So, for example, diabetes. If somebody's diabetic, you're going to say diabetes. Allergy is alergia. Flu, gripe. Cold, resfriado. This is actually incorrect, and I'm going to fix it as we speak because I want to make sure that you actually get the right spelling. There we go. And then arthritis is arthritis. Sunstroke, insolación. And then if you've been bitten by a wasp, bee, wasp sting, it's going to be picadura de abeja, avispa. Fracture is fractura, injury is herida. And I'm going to make a note here real quick. We're seeing la, or el. Remember when we talked about this, nouns are actually feminine or masculine. So that's the reason why you're seeing these. When it comes just to me, right now this lesson is just really focusing on medical terminology and you learning some of these medical terms. And so therefore, you may notice that I may not be reading la or el. The important thing about that is for you to know that nouns are either feminine or masculine in Spanish. All right, so when we talk about people, when you find yourself having a doctor's visit or in the emergency room, which I hope it's not the case, you're going to want to understand what people around you are saying, okay? So the following words will help you with this. So for example, if somebody is saying el doctor, la doctora, this is masculine, this is feminine. El médico is another way for people in this area to actually say doctor. La médica, and so it's the doctor. The nurse is enfermero, enfermera. The difference is this is masculine, this is feminine. The dentist, okay, la dentista. El is masculine, la is feminine. The surgeon, el cirujano, la cirujana. The paramedic, el paramédico, la paramédica. Once again, masculine, feminine. The eye doctor, el oculista, la oculista. And the ear, nose, and throat doctor, which is ENT for us here. I know that's a very common way for ENT. There we go. For us here is el otorrinolaryngologo. Otorrino, that is a very difficult word to say. El otorrinolaryngólogo. There we go. naringólogo. So make sure that you practice that. I have problems with saying that myself. So hopefully you won't have to say that whole phrase itself. Another way to shorten this and to actually make it easier, you can also say el doctor de nariz, boca, which is mouth, y oídos. Okay, if you want an easier way without having to actually say this whole huge word, so you can just say el doctor de nariz, boca y oídos, or doctor or especialista, which is a specialist. So there you go. That's another way to actually also approach this in Spanish, and you will be perfectly well understood. So here we go. That's that. So let's talk about places such as the emergency room. Es la sala de emergencias is the emergency room. La sala de emergencias. The hospital would be hospital, el hospital. The pharmacy is going to be feminine, and it's la farmacia. The operating room is el quirófano. The ambulance is la ambulancia. So now let's talk about some of the treatment. So let's say you've got to tell somebody that they actually need an injection, okay, or they need surgery, or they need antibiotics, or they need something. Okay, so this is how you're going to say it. Inyección is injection. Surgery is cirugía. Medicine is medicamento. Antibiotic is antibiótico. Anti-allergic medicine, anti-alérgico. Painkiller, analgésico. Cream, crema. Pill, pastilla. Notice the double L. That's why we're doing ja, pastilla. Drops, gotas. First aid, primeros auxilios. Stitches is puntos. Bandage is venda. Prescription is receta. And sometimes here you will hear that they add receta médica. Diagnosis, diagnóstico. Treatment is tratamiento. And I know I'm going through this fairly fast, but this is recorded video, so please make sure you pause as needed and go back and repeat. The best thing you can do is create, as I mentioned since video 1, creating your own personal dictionary for this. Okay, so some of the useful phrases that you may come across is, and this says, now that you've got the vocabulary, so make sure that you do know that you need to probably pause and go through these and learn most of these, okay? So some of the other common phrases that you may run into is, for example, when somebody wants to tell you, I am sick, they're going to say estoy, which means I am, enfermo, enferma, depending on if you're male or female. I don't feel well, no me siento bien. I had an accident, tuve un accidente. I need help, necesito ayuda. Where is the hospital? ¿Dónde está el hospital? And I want you to notice that in the Spanish language, usually if you ask a question, when you do it in English, it's only going to have one question mark towards the end. In Spanish, the correct way to actually do it in Spanish is actually also add the upside down question mark. You don't really see it used here, but that is actually the correct way to use it. I need a doctor. I need to see a doctor would be necesito ver un médico. Or you can also say doctor, which is probably what you're going to hear in this area. Call an ambulance. Llame a una ambulancia. My stomach, throat hurts. So me duele is the word that we're looking here to teach you. Me duele. Because el estómago, la garganta is part of your vocabulary as well. I hit me golpeé, la cabeza, la espalda. I have fever is tengo fiebre. 48 hours of rest, 48 horas de reposo. And remember, we went over numbers, so this will change as you need to, but hours of rest is horas de reposo. Drink lots of liquid, tome mucho líquido. Take the antibiotics every 8 hours. Tome el antibiótico cada 8 horas. If you need to change it to fewer hours, we've gone over numbers, so just replace that with that. Do you have health insurance? Tiene seguro médico. Spanish also has similar sayings to the one in English as mejor prevenir que lamentar. That is a saying in Spanish that you will hear frequently. It's better to prevent than to regret. And we're going to get into fundamentals. This is going to be part of video 2 of this week's medical terminology lesson. I actually recommend that you pause this video before you begin the next video that I will be assigning to you. Make sure you understand the basics that we just went over. The next video will be a little bit difficult to understand if you have never been in the medical field. So I'm going to make sure and ask you to take your time to actually pause throughout it as well as needed. I'll be back during video 2.